Hello everyone and welcome to today's Lunch and Learn organised by North Cumbria Integrated Care Trust and Boost, the North East and North Cumbria Learning and Improvement Community for Health and Social Care. It's good to see everyone here today. My name is Richard Laurie and I'm Head of Knowledge and Library Services at North Cumbria, but it's my special pleasure today to welcome Maxine Wright, who's Medical Information Scientist, and Paula Russell, Principal Pharmacist at the Regional Drug and Therapies Centre, who will be talking today about the Yellow Card Scheme, important update to the reporting service. The idea of these lunch and learns is that they are a relaxed, informal space for health and care staff to come together to share experiences, learn something new relating to health and care, focus on quality improvement, be signposted to further resources, and of course, all while eating your lunch or watching it later on the recording. Just during the session, we do have one or two protocols. So if you can keep your webcams off unless invited, and also mute yourself when not speaking, just so we don't get any feedback. We will be using the chat during the session. So if you have got any questions or thoughts as you're going, please do feel free to pop any things that you would like in there. But we do have a question session at the end. So at the end of the session, you can ask Maxine and Paula anything you like, either through the chat, or if you pop your hand up, you can unmute and ask them that way, and they'll answer any questions you've got. And then also just in the chat, we will be putting a survey in just for feedback and suggestions for future topics on this session. So yeah, if you could complete the session, that would be very much appreciated. And finally, just a reminder as well that we are being recorded during this session. So do feel free to share the knowledge you get on this session today, but also the recording will become available. So if you'd like to share that, do feel free. So having gone through all the rules and regulations, Maxine and Paula, welcome. Thank you.
Thank you, Richard. As Richard has alluded to, my name is Maxine Wright. Forgot my name then. I'm a medical information scientist based here at the RDTC, and I'm joined today. My wing woman is Paula Russell, and she's a senior pharmacist who is a special interest in medicine safety. So what we're going to do today is a brief introduction to Yellow Card. Now, the RDTC look after the Yellow Card service for the Northern and Yorkshire region. And so this is why we're coming to you from a slightly strange route, but that's what it is. That's how it's set up. We're also looking at some of the new features you may not be aware of regarding Yellow Card, and also just finishing up with a little chat about Medicine Safety Week 2024. So just to put it all into context, bring your attention to this poster, a safety poster from the BMJ from 1951. And to all intents and purposes, this is an advert to show that to sort of stem the tide of the rising incident of barbiturate overdoses in both adults and children, and it was accelerating in the 1950s and 60s, and to advertise, a new safe sedative. And those of you with really good eyesight will actually notice that Distaval, which is being advertised here, its generic name is actually thalidomide. So I'll let you think the irony of that advert sink in. And this is actually what prompted the Yellow Card system to be set up in 1963 after the thalidomide tragedy. And it's a way of collecting and collating and investigating reports of suspected adverse drug events or side effects, as we always commonly know them. So the MRHA still run the Yellow Card scheme, and it relies on the input of reports from healthcare professionals and patients, but we'll see that in a minute. And as you can see, it's really well supported. It has received in excess of 40,000 reports annually, and over 1.7 million over the time that it's been running. So there have been a number of changes throughout the whole of the Yellow Card system, and so I just wanted to go through these 4 areas to make sure that you had the most up-to-date information regarding them. and this is the reason for coming to see you today. So who can report adverse drug events? It's only surprisingly that actual other healthcare professionals, such as pharmacists and nurses, midwives, etc., have really recently been added to the list of people who can report. From the start, it was doctors, coroners, and dentists only. But I suppose the big news is that since 2008, it's been patients and carers who actually can report yellow card into the system. Obviously, this is really important during COVID in 2020-21. We had obviously a mass vaccination using new products, and that information was really important to the MRHA and obviously the wider medical community. So I think it's probably important at this point to note that even if there is a report made by a patient, it shouldn't inhibit you as a healthcare professional or vice versa to actually add in that report. The MRHA can actually sift duplicates, and they can actually add the sort of together to make a combined report, hopefully a more bigger picture. So it's better to do it than not and think that somebody else will do it. So what can you make a report about? I think it's really easy to think that it's just medicines, and that's what traditionally it has been. And obviously the side effects are, associated with their use. However, this list has been recently expanded to cover all sorts of treatments and methods of getting the treatment to the patient. Sometimes it might be easy to think about it a different way. So if you think about things that have been prescribed to you, so obviously medicines, but then obviously devices, inhalers, dressings, close glucose monitors such as Freestyle Libre or Dexcom, they also have obviously a massive impact on a patient's life. Things that patients might buy, so vitamins, herbal remedies, e-cigarettes, and obviously the bigger picture now is the purchase of medicines online. Legal or not, I'm not going to judge, but obviously the medicines that people buy online could be falsified medicines, and we need to know if there are false medicines being sold. We need to know if there are serious side effects associated with them as well. And also it's important to think about the things that you've been given, maybe when you're in hospital or when you've been in the surgery. So if you're looking at vaccines, blood products, or any other medicine or product that you've been given whilst you're in a medical setting. And don't think that it's a black hole. The MRHA do actually produce interactive drug analysis profiles, which they host both on their website and on their app, which gives you a picture of exactly what ADRs have been reported, how many there were over a set number of time, and to what degree they affected the patients, whether it be mild, severe, or unfortunately a fatal result. So how can you make a report? I think a lot of us older, I include myself in that, will remember the paper cards at the front of the paper B&F, and I think you can probably still get a few of those. You can also print off a paper copy of the report from the website of the MRHA, although it might be easier actually just to use the online reporting system that the MRHA have, which is the web address there. We also have the embedding of the yellow card reporting system within your electronic prescribing systems. So for healthcare professionals, you may be using EMIS or System 1, and there should be a button where you can press which actually will lead you through to the yellow card reporting. But the new system is using the app, which you can obviously download on your telephone, on your smart devices. Not only, and as I alluded to before, not only can you make a report through that, you can actually look at the interactive drug reports as well to see what's actually being reported about a particular drug or device or falsified medicine or the other rest of the list. So coming right up to date, this is the enhanced services that we now have in the Yellow Card Biobank. So the rest of the changes were really about the admin. This is actually regarding the data that's gathered to actually make a direct difference to patient safety. So the MRHA, in partnership with Genomics England, have started a project to contact patients who have had an adverse reaction to either DOACs, which are put my teeth in, anticoagulants such as apixaban or rivaroxaban, or a skin reaction, a severe skin reaction to allopurinol. Patients will then be asked whether they would consent to a blood test, which will then be genetically sequenced. Now, cutting out an awful lot of information in the middle, this is basically a way of paving the way towards patient-specific medication decisions for the future, and hopefully avoiding some of the ADRs that previous patients have had to undergo. So that started this year, and I think will carry on for 18 months or until they have the necessary numbers to complete the project. Well, 1 minute then, I didn't think it was going to happen. So I'm not going to play this today, but it is there for your information. There's a nice little video and some more information regarding the Yellow Card service and the Genomics England project. I would encourage you to have a quick look at those. Only a couple of minutes long, but they're nice and factual. And if you have a patient who comes in and asks, why am I being asked? This is a way of actually either showing them or explaining to them what's actually happening. Sorry, I've lost my mouse. There we go. Okay, so looking at sort of the future of Yellow Card in the Northern region, I suppose I should have said at the start, myself and Paula have just basically taken on this project from another member of staff. So not new to it by any, well, I am new to it, but Paula's been involved for a few years. But we're really looking at how we deliver training and make this a sort of a two-way conversation with yourselves regarding Yellow Card. So if you need some more information, or if you want some specific training for healthcare professionals, or if you are a member of a patient group, then please get in touch. We will be happy to come and talk about Yellow Card or do something online such as today. You could even be a Yellow Card champion. I mean, if you're so enthused about it, which obviously me and Paula are, then please put your hand up if you want to spread the news about Yellow Card within your group, within your practice, within your locality, and just be a focus for people to come and maybe ask for help or say, is this relevant? Then yes, please become a Yellow Card champion if you've got any medicine safety interest. And then obviously everybody in between the 4th and 10th of November will have a massive medicine safety interest, because it's going to be Medicine Safety Week. So I would keep an eye out for the posters and adverts in the press. This year's theme is, I'm going to read this out because it's quite lengthy, the importance of using medicines in the right way to prevent side effects and to report side effects when they do occur, which all intents and purposes is a mouthful, but it's a very important way. There's not much point in prescribing usually costly, unfortunately, medicines for people not to use them correctly, and then have obviously an issue which actually might put them into a worse state than they were in the first place. So Medicine Safety Week, I'm sure you'll see lots of things around advertising that. So some resources that just think might be useful to you. So we have an email address that will get straight through to myself and Paula. If you want any more training or more information, then please drop us a line. You might also want to go onto the RDTC website. So not only there does it have some Yellow Card pages, but it also has the rest of the output from the RDTC regarding prescribing. If you are an NHS.net email holder, if you work for the NHS in this area, North East and North Cumbria are a stakeholder in our products, so in our services. So all the reports that you will find there, whether it be on prescribing or incidents of safety or anything that we put out, it's worth registering for the site, having a good look around, because it really is a resource there for you to use. And finally, there's obviously the MRHA Yellow Card website itself. Lots of information. I was actually having a poke around yesterday, and I think the most informative was a page looking at what's been reported and then exactly what actions were taken. So it's not just a dead end. It's you put a report in. Obviously, it takes a couple of reports. It might take one report. It might take a couple of reports, but then they show actually what actions were taken. So it does show that making a report does make a difference. And then we just have the cartoons, which are very popular on the MRHA website, about Med Safety Week. And please remember to fill out your yellow cards. But thank you so much for your time today. Probably at this point, I would imagine that Richard and Amy are going to step in and talk about the evaluation form. But thank you for your time.
No, thank you, Maxine, and thanks, Paula. No, that was great. That was very clear. And yeah, I think you underlined well the importance of reporting and how it all works. So that's incredibly useful. So yes, so just anybody who's watching, yeah, we do have our questionnaire form for you as well, if you wouldn't mind filling that in. But I did just wonder, just at this point, if anybody has any questions. Can't see.
Well, that's it. I'm in a coma.
No, I think you were really good, clear and concise, Maxine. So I think you got the message over, which is great. So fantastic. And I think, yeah, this is definitely one of those sessions where when the recording's out, I think it would be worth people passing on, because it does just give a really good overview of what the yellow card scheme is. So yeah, thank you for that.
You're welcome.
Thank you.
So
I've just popped a few links into the chat as well that I thought, as Maxine was speaking, that might be quite useful. So I just popped them in the chat if anybody wants to.
Oh, great. Thanks, Paula. Yeah, because the chat can be accessed after the session's finished as well. So that's very useful. So yeah, so just to advertise our next session, which is on the 14th of November at 1 o'clock with Dr. Laura Coulthard, who's the NIHR award holder and honorary clinical psychologist for Cumbria, Northumberland, Tyne and Wear NHS Foundation Trust. And that will be on working with gender diverse young people across North East and North Cumbria. But yes, so I'd just like to finish off by thanking Maxine and Paula once again. It was great to see you there, and thank you everybody who attended today.
Thank you for listening.
Thanks.
Yeah, thank you.